It's such an honor to play a co-sponsoring role in today's wonderful conference, and I want to just give a nod of gratitude to Ford and Kendall for all their hard work, and all of our other partners at Geisel and the Dickey Center who've really played the lead role. I also want to take a moment to recognize every single person in this audience. So I looked over the registration information for the 200 plus attendees, and among you all are basic scientists, clinicians, primary care clinicians, infectious disease clinicians, policy analysts, philanthropists, hospital, and academic leaders. So thank you for taking time out of your day to be with us. I am in awe and inspired by the work that all of you, our audience members, do, and it's a real pleasure to be here today. So before we start Q&A, Ford has kindly offered me the chance to offer some reflections on the potential role of business schools and academic vaccine initiatives like today's conference and beyond. Most of my comments are really in the spirit of amplifying a lot of what we've already heard in the day and a lot of what we heard this morning in particular. On my mind is how industry stakeholders plug into the vaccine landscape to scale and sustain the critical work performed at the bench, the bedside, and in broader community health programs. So at Tuck, we have a core focus on innovation, and more specifically on the web of partnerships referred to by my strategy colleague Ron Adner as the innovation ecosystem that brings medical technologies, including vaccines, to the broader public in a financially sustainable manner. Dr. Wagner, I noticed you used the ecosystem language earlier this morning, showcasing your MD and your MBA chops, which I was delighted to see. So I think of the venture capitalists and angel investors who help fund exciting but risky basic biotech research, including that on vaccines. And aside, with respect to funding, Dr. McClellan, as a native Texan, I was tickled to see the infographic for Tito's handmade vodka on your funding slide. Yeah, so partnerships come in many forms, and like I said, as a native Texan, I was delighted to see that. I think of the medical affairs professionals keeping the lines of scientific communication open between vaccine producers and clinicians. I also think of insurance executives designing pay-for-performance bonus initiatives and Medicaid managed care plans with the goal of boosting vaccination rates among children and low-income adults. We are all, of course, sufficiently aware of the tensions that can arise between for-profit and non-for-profit stakeholders. Dr. Connors, your comments during the Q&A really landed as an example. But I think we can all admit that we're all in this together, Republican or Democrat, as Dr. Nyhan's work demonstrates. In the spirit of turning vaccines into vaccinations, we must create bold new partnerships that transcend sticky stakeholder tensions. Indeed, we must create brave spaces, to quote President Baylock, where participants can come together with the requisite psychological safety to reflect, connect, dream big, and act. I can truly think of no better setting to pursue this than Dartmouth, where we faculty across Geisel and Thayer and Tuck and the college come together to share a meal, to share a stage, and to bring together some of the finest scientific minds in the world. So again, I'll just conclude by saying it is an honor for the Center for Healthcare at Tuck to be a co-sponsor today. We look forward to supporting future vaccine initiatives at Dartmouth. Thank you.